Okay, I will be demonstrating IV insertion. The 13 safety practices are to check the doctor's order, hand hygiene before and after patient care. You want to check the facility procedures and policy, look at the manufacturer's recommendations, and then I'll come in and knock on the patient's door, identify using 2 identifiers, note their overall condition, explain the procedure, and provide for privacy. Then I'll raise the bed to good working mechanics, put on appropriate PPE. Once I'm done with patient care, I'll lower the bed back, give my patient the call light, make sure they're comfortable, and then document. And for IV push, we'll want to make sure that the instructor is present. And since we will be administering a medication, the med administration rights are that the right patient gets the right medication, the right dose, the right route, at the right time, the right indication, and the right documentation. So I'll go ahead and start. So our first order is to insert a saline lock and draw a CBC. So I'm going to get my tourniquet. And find the vein, find a good vein. So now I'm going to clean with chloroprep. Sure that's clean. And then let it dry. And as that's drying, I would prime my extension tubing, check my needle, make sure it's intact. Get the tape ready. Alright, so this is dry. I'll go ahead and reapply tourniquet. And my needle bevel up. And I'll pull the vein. We'll go in at 10 to 15. And we'll look for a flash of blood. And then advance the catheter. Apply pressure. Put in sharps. And from here, I will attach my syringe and draw the appropriate amount for the Chem 7 CBC and put it in the correct vial and send that to the lab. Then I will attach my extension tubing. Make sure that's tight. Okay, and then I will apply my dressing. Make sure it's initial, timed, and dated. And that's on, then I will tape it down. So that is done. And I will go ahead and flush and look for any kind of complications, any infiltration, phlebitis, irritations, and it is patent, so go ahead and take that off. And then I will go document how the patient tolerated and everything like that. And our next order will be to hang normal saline at 125 milliliters. So I will get my saline. I would spike it, prime my chamber, hang it, and then I'll prime my tubing for air bubbles. And then it's primed. Then I will get my alcohol, clean the hubs, and attach. And that will be set to run at 125 milliliters per hour. And then I will document, make sure the line's still patent. And then we have another order for medication for morphine, 2 milligrams of morphine, stat. So I would come in, check my patient, get my medication, which will be diluted in 5 mLs of solution, and it will infuse over 45 minutes. So here's my morphine. I will clean the port and then attach. And this will infuse about 1 milliliter per minute. And once infusion is done, I will continue to look at the site, make sure there's no irritations, no redness, inflammation. I'll be sure to let the patient know to report any signs of inflammation, irritation, and then I'll come back 30 minutes to check on the patient. And then I will document and